Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a special episode for you tonight. We're talking about St. Luke's and their experience through the COVID-19 pandemic. We'll be joined by a panel of leaders who helped guide the network through tough times and adversity. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at the COVID-19 experience with St. Luke's University Health Network. Stay tuned. Thanks for joining us. Let's get started. We have an impressive panel of guests joining us tonight. Up first, we have Carol Copeland. She's the president of the Bethlehem campus and serves as chief nursing officer. Carol has an MSN from the University of Pennsylvania and a BSN from Georgetown University in Washington, D.C. Carol first joined St. Luke's as patient care manager and has been faithfully serving and leading the network for over 30 years. Carol, thank you so much for being here.
And Ashley, thanks so much for having us. We're all thrilled to join you today.
Carol, you've been a nurse your whole life, and now you're the chief nursing officer. Tell me a little bit about the impact COVID had on the nursing staff. They're really on the front lines and had to react so quickly to everything that's been going on.
You're absolutely correct. It had a significant impact, Ashley, but never more proud to be a nurse than today, because I think it brings out the best in my nursing colleagues to recognize that they are the difference in saving people's lives. And that's exactly what we have done over the past 9 months.
Next up, we have Dr. Jeffrey Jari, the Senior Vice President of Medical and Academic Affairs and Section Chief Emeritus of Infectious Diseases. Dr. Jari is board certified in internal medicine and by the Subspecialty Board of Infectious Diseases. Dr. Jari has been with the network since 1978 and is also the host of St. Luke's award-winning television program, Talk with Your Doctor. Outside of work, he enjoys Western horseback riding, American history, and military collectibles. Dr. Jari, it's so great to have you. Thanks for being here.
It's a pleasure to be here, Ashley.
Dr. Jari, why was it important to include science and data in your communications, and did that resonate with the staff?
So what we're trying to do is to actually be the unbiased area that we can hopefully have our public rely on. And the way that we can do that is to give them the facts. And the facts are unvarnished. And we're very honest in also telling them what we don't know. And that's extremely important to do. And that way, we can hopefully maintain a public trust. And I believe we've been able to do that.
Finally, we have Evan Oakes. She's the interim senior vice president of human resources at St. Luke's. Born and raised in the Lehigh Valley, Evan received both her bachelor's and master's degrees from Lehigh University and is a certified senior professional in human resources. Evan first joined St. Luke's in 2011 and has successfully developed and implemented various human resource strategies for the network. When she's not working, she enjoys being with her family and friends, beach trips, and long-distance running. Evan, we're thrilled to have you on the panel. Thanks for joining us.
Thanks, Ashley. I'm happy to be here.
Evan, throughout the pandemic, the network made patient and employee safety a top priority. Why was that so important?
Honestly, even without a pandemic happening, we have to think about our patients. We have to think of our employees, at any given time. And certainly during this time, our employees were top of mind, their safety, their well-being, making sure that they were communicated to. We had to focus on that, probably at a higher level than ever. Because honestly, at the end of the day, we knew that if our employees were happy, we knew if they were well cared for, that they would take care of our patients. And I feel really proud of what we did during this time. I think we made sure that anytime we had an update, anytime that we learned something new, whether it was from our clinical leaders or from the CDC or from our state governments, we passed on that information to our employees, knowing that they would feel safe and protected and prepared coming into work every day. And that would then lend over to how they cared for our patients as well.
Amazing insight. Thank you all for sharing your experiences from the first stages of the pandemic. Next, we'll learn more about communication throughout the network in the days, weeks, and months that followed. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
My initial reaction when the pandemic first hit was, we got this, it's like the flu. I didn't really think anything of it, and then after I did a lot of that prep work, it was time for me to go back to the bedside. And that was when I realized that COVID was unlike the flu in a lot of different ways.
I took care of the first patient at Anderson that had COVID, and then it became real.
Every time someone came in short of breath, it was, is it COVID? Is it not COVID? But we still had no idea.
The nursing staff had to be innovative when we were treating the patients by using different members of the care team in different roles and responsibilities than we had normally. So we would work with our respiratory department when they were in a room already gowned up to do our AM care, and we used the OR team. They came in and were assisting the nursing staff to provide care and delegate tasks that we as critical care nurses don't always like to delegate off.
We really had to learn a whole new model of nursing, sort of on the fly. We also implemented walkie-talkies, which were actually good comedic relief as well. It really helped us sort of cope in real time. And then we did implement baby monitors.
With our pumps, we had like trees of pumps outside the rooms. We had to get really long extension tubing that would still work, whereas our normal extension tubing is really thin, so it's really hard to get all of the medications the whole way to the patient.
When it came to proning patients, we developed what we thought kind of like a proning schedule, so that the team would go in, turn that patient, kind of reset, take a little bit, and then go to the next patient.
We worked together really well and were innovative in the ways we provided care.
There was a lot of fear of the unknown and a lot of fear of, am I at risk to bring this home to my family and my loved ones, and am I going to get it myself? And I think, at the end of the day, being a nurse is about taking care of that person in the bed, no matter what brings them to the hospital.
There were a lot of things that gave me the drive to keep going. The support I felt from my coworkers, from managers, and then sometimes when I would come home just from the community. There was a time I remember coming home exhausted, and there were signs all over my lawn just saying how much support I had.
I love being a nurse because I genuinely love helping people.
The nurses I work with are amazing. They have gone above and beyond, and I'm just so thankful I can be part of a profession that can be a part of that.
I've never been more proud to be a nurse than now.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our panel for joining us in this special edition of our show, and to our viewers for watching tonight. If you're just tuning in, we're joined by Carol Copeland, Dr. Jeffrey Jari, and Evan Oakes. We've started to discuss your individual experiences through COVID-19, and now we're going to discuss the communication throughout the network. Carol, let's start with you. This hospital network is so many hospitals and many presidents and many leaders now. How did you all communicate, you and the other leadership, about the best practices and the best ways to lead your campuses and share those ideas? How'd you do that throughout this pandemic?
So I would say we had multiple avenues for communication: written, oral, town halls, team meetings. And if I think about the communication between our senior leadership, we communicated on a daily basis. If I think about the personal protective equipment you so often heard about, PPE, that was something we discussed daily and strategized on how best to use it.
In addition to talking to each other, talking to staff, talking to patients, Dr. Jari, you also need to talk to the public. And you've got a show, Talk with Your Doctor, that's been on WFMZ for over 30 years, and it's been a wonderful way to get information out to the Lehigh Valley. Tell me a little bit about how that helped you keep viewers updated on St. Luke's during COVID.
We actually realized that this was a terrific opportunity to give the public what it needed at the height of the epidemic in our area. So what we decided to do is to abandon our usual format of different shows and to make every show that we did on COVID-19. And we were able to bring in a variety of different guest experts that are part of our team. It was able to answer the kinds of questions that people actually had about this epidemic.
Evan, your role in human resources is really to ensure the safety of staff members so that they can subsequently better serve the community. How did you guys do that?
I think Carol hit on a really great point about PPE, or protective equipment. We had to make sure at any given time that we were prepared. We had the right amount for every employee dependent on their role, and making sure truly that they felt safe every single day coming to work, knowing that they had a job to do to take care of their patients. And honestly, at any given day, our employees have a tremendous sense of duty. And during this time, we continue to push that message that as healthcare workers, they have an obligation to not only care for themselves and protect themselves, but also care for the people that are interested in their care. And I think they did a fantastic job on their own, focusing on the community efforts, focusing on taking care of their patients. And we really pushed that message, but it really came from within. And I think championing that message as a community and as an employee base, they did a really fantastic job.
Great information from all of you. It's really wonderful to hear you were able to keep open communication at all times, not only to better serve the team internally at St. Luke's, but to also serve the Lehigh Valley. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
I'd like to give a shout out to all the people in the entire organization that really, really worked hard during this COVID epidemic. But the people that I think deserve a big medal are the people that worked in dietary, in environmental services, and maybe some of those individuals that weren't on the front lines seeing patients every day. We need every one of you. You're all an important part of our team. And without you, the caregivers and those people with direct patient care experience wouldn't have been able to do their job. If you think about it, I'm one of those people just like you. I'm behind the scenes. I don't see patients, but I consider my job as essential. And you know what? I think yours are every bit as important as anyone's else. We wouldn't be here today with the success without your support, your passion, and your hard work. Thank you. Well done.
Thank you so much for your support, Mr. Anderson. It's been incredible to see how our community really stepped up to support the staff at St. Luke's. I'd like to talk about some of the best practices that all of you have learned and put into place during this pandemic. Carol, you mentioned earlier town hall meetings, and that was something that you put together and your campus took care of. What were they and why were they so important during the pandemic for communication?
When I think about the importance of our town halls here at St. Luke's, I don't think we can underscore those enough. It was actually the brainchild of Richard Anderson, who's the president and CEO of the network, because he had a strong commitment to make sure that he could communicate with all levels within the organization. And it was very important for them, each one of those individuals, to hear that Rick was attuned. He was in on all of the detail of what was happening, and he was leading through this process. And I think it gave our staff and our physicians a confidence that our network had this situation under control.
And that confidence is so key. Dr. Jari, there was something going on called the COVID Chronicles. Can you tell us what that is and how did it keep the network, 15,000 plus people, on the same page?
We have a particularly gifted individual, Dr. Kara Massetti. So she was very well suited to be able to have the assignment of internal communication. And she developed this system, what we called COVID Chronicles, where she would put out these emails that would go broadcast throughout our entire network. And obviously there's a great representation of everyone there. And what she would do is to give everyone the latest information that we had that was specific to our organization as well as to the epidemic in general. It had a lot of guidance. It also shared many of the same fears that we all had and anxiety, so that people understood that they weren't alone. And she was doing this sometimes 3 or 4 times a week at its height. And I think it really helped people feel that we were part of a whole and that everyone was getting the same kind of information and that we were able to also answer their specific questions when that became available as well. We now have resumed it in a very active way because we're now seeing, unfortunately, an uptick. And again, I think she has done just a wonderful job in making this very easily understandable and appreciated by virtually everyone who reads it.
Such a great example of how communication can really bring people together. And Evan, so tell me why over-communication was really the theme of Human Resources and the St. Luke's leadership team during this time.
Absolutely. So I have to brag for a minute. I think we've always done a great job with communication. And traditionally it's been face-to-face or it's been via email, but we really knew this time that we had to up the ante and communicate in every mode of communication possible in every channel. We heard loud and clear from our employees that we met the mark. We got information out just in time. We were very transparent. We were clear with our messaging. And if I look back, there's really nothing I'd say we would do over, because at the end of the day, we got the message to our employees. We made sure that they heard every change, every update, or any policy protocol that was coming out throughout this time. And I think if I really reflect back, we had some success stories. We also set up an online and virtual call center for all of our employees to call in if they had a question regarding COVID, an HR issue, a policy issue. They could talk with a live representative at any time during the week. And we got great feedback that that was something that was just in time during this pandemic.
Carol, I want to ask you a little bit about the innovation. I know the Simulation Center at Bethlehem is so well known for really giving staff an opportunity to learn, but they turned into an innovation center during this time. Tell me a little bit about how those 3D printed masks came about.
Sure, Ashley, I really do believe the innovation and the creativity and the agility of our network was paramount in our success. So starting with the simulation lab, we very early on realized that PPE availability across the country was going to be challenging. And our simulation team, led by Megan Augustine, led the charge with saying, what are the core pieces of PPE you need? And let's see if we can't make 3D models that would work. We not only made those models, but we tested them because we wanted to make sure that the safety of our staff was protected. So they did a beautiful job with disposable stethoscopes, eye masks, the masks themselves for over the nose and the mouth. All of those things were key to making sure that we had sufficient resources here. We have to remember that there was an incredible fear that people had that they were going to contract this disease, and that they heard in the national news, and in particular with New York and New Jersey, that there was a shortage. So that was paramount in everybody top of mind. And I have to say our team did a marvelous job. And it probably for me underscores the team effort here, because truly throughout this whole process, physicians and nurses typically get so much of the recognition because they're frontline, they're patient-centered. But neither of those professions could do the work that they did without the entire organization.
And this was not only the only innovation during this time. Dr. Jari, the network invested in installing air filtration systems throughout the network. How did this help combat the spread of the disease? And why was this so innovative, really?
One of the things that we ended up having to do is that we made sure that we had an increase in our isolation rooms that had what is known as negative pressure. And that means that when the door was open to the room, that the air goes in, it doesn't go out into a common area like the hallway. Secondly, we also installed what is known as HEPA filtration, which is high efficiency particle air that helps to filter out really all of the things that you don't want in the air by using the right kind of filter. And this was installed in certain areas where we felt were particularly at high risk, and in sometimes throughout an entire building. So our results, I think, have shown that all of these methods have worked to keep both our employees and our patients safe.
All of these are great examples of how the St. Luke's network successfully navigated through tough times. Let's take a look at some other ways ingenuity came into play from the staff at St. Luke's.
In March, obviously, it was out there as something that was facing us. The pandemic was becoming real to us.
I think it was a lot of unknowns. We saw things going on in Asia and Europe, and there was even a question of whether it was going to hit us. So it was kind of like preparing for a moving target. There were so many hypotheticals or scenarios. Our priority is taking care of our patients and providing them care. And we realized that if we didn't come to work or we were paralyzed with our fear fear, we couldn't carry out that mission. We had the tools, we had the skills, the education, so it's kind of taking that pause and then saying, okay, we got this, we know what to do. I think very telling of St. Luke's culture is from the very beginning, our senior leadership to the level of Rick Anderson, our CEO, down to individual, nurses and docs on the front line, all mobilized and were involved.
St. Luke's reaction to create the COVID response team was we knew that the virus was coming, it was coming to our area quickly, and so we responded quickly by setting up our command center structure.
The purpose behind the Network Command Center was to assure that we had pristine communication.
St. Luke's has always worked together as a network approach. We have now 12 different hospitals, but we really focus on trying to standardize our care, our quality, our protocols across the different systems. So we had members from each campus who represented their entity on that command center, so they were bringing issues directly to us and then disseminating and bringing information to their campuses.
We saw a huge shift for the need with people not being able to be face-to-face and in rooms. We saw the need to basically set up technology to help support more of a virtual. So the role of Microsoft Teams within St. Luke's was pretty critical.
We decided that it was really important for staff, both employees on the front line, people working from home, people in our offices, to understand what was going on with coronavirus and how we were responding. COVID Chronicles was a daily email communication that I sent out pretty much 7 days a week. With any public health crisis, you just need to have the consistent, constant reinforcement of what our plan is, what we're doing, and that everything's going to be okay.
One of the great things at St. Luke's is teamwork, and we really pride ourselves in working together, and whether it's on a daily basis or during a pandemic, everyone's just all in on how we can help. I had about 200 people involved in helping us manage our PPE and inventory control across the entire organization.
We were well equipped during the entire crisis phase, and I think that was a positive and a comfort for the staff and our frontline providers.
We rapidly mobilized and came up with a treatment algorithm, and our clinical outcomes and mortality are better than some of the national statistics, and our rates of employee infection were much lower than the national average.
At the end of the day, our PPE and the results of what we were able to do were to save lives, and I think that's probably the most important thing.
Planning for a pandemic isn't just about medicine and nurses and doctors. There's the whole gamut of what a hospital does, from environmental services to dietary to materials management, supply chain. Everybody is essential in fighting this pandemic. It's not one person is more important than the other, and everybody feeling that they're part of the team, they're safe, and really that, St. Luke's is providing care. We're all proud and happy to be with this team.
There were no silos. It was one team working for the greater good. That was very impactful for me, 42 years down the road, believing I'd never see a pandemic, having lived through it, and seeing coming out on the other side in terms of decreasing volumes and better clinical therapies, for me has been something I never wanted to face, but I'm very proud of how our team faced it.
Welcome back. You're watching St. Luke's Health Now. I'm your host, Ashley Russo. Thank you to our panel for not only being on the front line of this pandemic, but for joining us to talk about their experiences. During this time, you were all selflessly supporting other people. Let's talk about how the network supported you and your teams. Carol, how did the staff participate in shared sacrifice to get through COVID-19? They did things like pay reduction, job sharing. And what does this say about the team mentality at St. Luke's?
I think our reaction to this as a team is a source of pride for the entire network. Again, going back to the peak of this, there was a state mandate to cancel all of our elective surgery, all of our procedures, to really limit what typically is the way that hospitals are funded or generate revenue. So very quickly, there were a number of people who were impacted, and we, rather than to do a mass layoff, which a number of institutions did, we put in a job sharing approach so that we had people working at least some time so that they had some sort of an income. In addition to that, we had people who retrained in jobs. We had OR nurses who came out to help us take care of COVID patients. We had nurse anesthetists who retook critical care courses so that they could help us care for patients. All different types of examples of people who came forward to say, I want to help in whatever way I possibly can.
Evan, what motivated you and the team at St. Luke's to keep the staff supported and motivated during all of this?
I think that's great. I think we've touched on pride, and I think pride has always been a huge value system as part of St. Luke's and our culture. And it's been amazing to witness that joy and that pride coming through during this time, even during the most difficult times. And I say that with full respect for all of our staff, our clinical and non-clinical staff, all really rallied together. We faced unknowns. We faced a pandemic that nobody had the playbook for, but really, it was our employees who got us through this time. And that personally makes me proud. I know our leadership team is very proud of our staff as well. And if you look around our 15,000 plus employees, there was so much unity and there was so much strength with the energy of our staff coming together and trying to get through this really difficult time. And as we come out of that difficult time and go into the fall, I know we're going to see the same thing again, where our staff truly take care of each other, they motivate each other, and that sense of pride will continue to be there.
Dr. Jari, both Carol and Evan mention the team coming together to support each other, but also taking on different roles and really being agile, learning new things, stepping in where they're needed, giving up PTO time. Why is it so important that the team supported each other in this way? And how do you think that's truly benefited our Lehigh Valley community?
Well, simply speaking, we consider ourselves family. And this is what families that are good families do. We're not just here to share our successes. There are a lot of organizations that do that. We're here to also share the challenges that we have. And certainly this was a challenging and remains a challenging period. And with that kind of support, it helps us all get through this in a far better way than we would if everyone was acting totally independently and not really caring for each other. So again, to echo my colleagues, I am proud of our family, and I'm proud that it has weathered this and will continue to do so.
Thanks to each and every one of you for sharing your insight with me and with our viewers. Up next, we're going to take a look at the patient experience at St. Luke's. Stay tuned. You're watching St. Luke's Health Now.
There was a lot of fear and a lot of trepidation out there and a lot of unknowns. We couldn't lose sight of the patient experience during this time. It was very important to remain open and have them participate in their care. I've been so impressed by the teams here taking care of the patients every day. They are the unsung heroes of our community and really coming in every day and needing to change as we learned. I had employees asking me what they could do to help, and even if we weren't using them in their role, they were willing to do anything that we asked them to do. Not only our clinical teams, but our non-clinical teams, nutrition services came in every day, fed our patients, they fed our employees, kept everything moving. Our environmental services and cleaning team really were focused on helping us really work through the pandemic together. So it was extremely heartwarming for me to be able to feel like I had an army ready to take care of the pandemic with me.
Thanks for tuning in to St. Luke's Health Now, and thank you to all of our panelists, Carol Copeland, Dr. Jeffrey Jari, and Evan Oakes for sharing the St. Luke's experience through COVID-19. For more information on St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for watching. Until next time, be well, and remember, it's important to focus on your health now.